Hi, I am Dr. Anjali Taneja, Principal Consultant Obs and Gynae, Cloudnine Hospital, Patparganj. Any bleeding from the womb that happens 6 months after cessation of your menses is not considered as normal and is called as postmenopausal bleed. So, any case of postmenopausal bleed needs evaluation. It can range from mild spotting to even heavy bleeding, but irrespective of the amount of bleeding, it has to be seen by your doctor. Causes in majority of the cases, in 90%, will be benign or non-cancerous, which can be simply vaginitis because your hormones have decreased now, cervicis or local infections or use of any hormone replacement therapy. But at times, in 10% of the cases, it can be a sign of underlying malignancy or cancer also. So this is not a complaint which should be ignored, and all postmenopausal bleeding should be evaluated. So once you go to your doctor will check you locally from down below to see for any local cause like any polyp or any growths, any infections, and the doctor may take your papsmear, which is a cervical cancer screening test, and advise you an ultrasound and maybe few hormones. So ultrasound is basically done to check the lining of the womb, to see the thickness of the lining of the womb. So after we have checked this, endometrial biopsy is advised to see why this bleeding happened. So endometrial biopsy can now be done in OPD or it can be done after admission under hysteroscopic guidance. So the first one is called as office biopsy. Office biopsy is done in OPD without any anesthesia. It is a accepted first line procedure, or it can be done under hysteroscopic guided after admission with anesthesia also. So once we have the biopsy, as we said, 90% of the time it is going to be a non-cancerous cause for which your doctor may advise you some medicines and keep you on follow-up. However, in the remaining 10% in which the cause is precancerous or cancerous, or even if the cause was non-cancerous but you continue to bleed repeatedly, you may be advised surgical removal of your womb. Now the surgical removal again can be done by open surgery or laparoscopic surgery.